Can I welcome everybody? It's great to see so many people here tonight. Apologies we started late. That is partly because the Parliament, if it's got a debate on, we're not allowed to formally start our cross-party groups until Parliament is finished. So it's quite a strict rule. And so sorry, all of those of you who had to wait before we were able to bring you up here. So I'm absolutely delighted to have everybody with us tonight. And I'm very much looking forward to this meeting. We don't have my MSP colleagues tonight yet. And what I was hoping to do, because this is
I'm online, Sarah. Hello.
Sorry, who was that?
Maggie.
Maggie Chapman, fantastic. Yeah. I need somebody else as well. So we were hoping to get, I think, Liam and who else? A couple of folk were due to turn up, who are colleagues. John Mason, Liam MacArthur, John Mason. So if anyone spots them online, let me know. But thank you for being here, Maggie, because it's a joint international development group and Malawi group. And it's the first time I've ever chaired two cross-party groups meeting together. And in a way, that tells you that this meeting is very special. So I'm particularly delighted to introduce Justice Patemba today, who's at the top table with me. We also have, this is before I get on to our key guests, we also have 5 students, I think, who've come down from Dundee, and you have all been to Malawi before. You've got the link with Malawi? I misread the brief. You were meeting with people from Malawi. Development. So it's really, really good to have everybody here tonight. I'm going to pause going through the minutes of the last meeting, because we need more than me and Maggie, I think, to do that. I think we need 3 MSPs in the meeting. So tonight it's quite a thrill for us actually to have representatives who are actually here from Kamuzu University of Health Sciences. And I'm going to pass across to you, Professor Chiotha, to introduce the group, because you'll do that in the right order and you'll get all the pronunciations right. And I think you've seen, even just getting which of my colleagues are in the room, I'm likely to make a mistake. So delighted to have you all here tonight, and we're looking forward to the presentations. And I think the idea of health, international development, Malawi, what we can do to share best practice and involve our academics is really, really important. The first thing I need to do is, the last thing, is that this event is being recorded. And for those of you who've not met the owl before, when somebody speaks, the owl moves around in the room and you appear on screen. It's a little bit intimidating. So very delighted to welcome everyone tonight. And we're going to try and finish around 7, but that's not 100% fixed. But I'm sure you've got other things to do afterwards, like have a decent Scottish dinner somewhere. So I'm going to hand across to you, Professor Chiotha. It's lovely to have you all here.
Yeah, thank you very much. It's a pleasure for me to be here. This is the second time that I've had the honor of visiting the Scottish Parliament. The first time was 2 years ago when I was receiving my honorary degree at the University of Dundee. I'm happy to see a lot of students from the University of Dundee. We appreciate this great partnership between Scotland and Malawi. The introduction, let me pass on to the Vice Chancellor. Over to you.
Thank you, Honourable. I have with me from my left, Benjamin Komwenda, who is the Director of Student Affairs, but also the lead for Scottish funded programs. I have Mr. Christopher Namagoa, who is the Registrar of the University of Health Sciences, and I have Dr. Belinda Kumbachika, the Deputy Vice Chancellor of KUHeS, and yours truly, Mark Mallewa, the Vice Chancellor of Kamuzu University of Health Sciences. Thank you.
I've been chair for only 1 month, so I didn't want to make a mistake. Back to you. Thank you.
So we're very much looking forward to the presentation tonight. And what we're hoping to do is to finish our discussions around 7. I don't know if anyone can see, but we have behind us a fantastic export from Malawi gin. I can tell you, Scottish people like exporting some of the fantastic whiskey we have, but we're very keen to test out some Malawi gin tonight. So I really am very keen just to hand over to get the presentation from the team tonight, because we've had a very long-standing partnership between the university, KUHeS, and Scottish Government, as well as other Scottish universities like Dundee. And it's really good to hear what that relationship has meant in practice. How that partnership and funding has also continued to enable the KUHeS development. So having you all here tonight is quite special. And you get to control the allocation of that investment at a local level, which I think is really, really important, so that you spend it in the way that's most appropriate for Malawi. And I know, having been to Malawi a couple of times, the issue of public health and support for hospitals is absolutely crucial. So having the academic research now and going forward is absolutely critical. So we're very keen to hear from you, and we know you've had a very busy week, so we're delighted that you're actually able to come and visit our cross-party groups. So I'm going to hand over across to you, Professor Chiotha, or do you want to hand across? Who's kicking off the presentation?
Yes.
And
Yes.
some like the Professor Mac. In Scotland, your name would also be cut short to that. Keeping in with our spirit. Over to you.
So thank you so much. It's a great pleasure to be here, and we bring warm greetings. We bring warm weather from the warm heart of Africa. So it's great to be part of the celebration, celebrating years of partnership between the Scottish people and the Malawian people. A partnership that is of mutual benefit, a partnership of mutual respect, but a partnership that is built on solid ground. So it's great indeed to be part of that, and we are delighted and excited, and it's a great privilege for us to be here in the Scottish Parliament. Just maybe let me try this.
Sometimes on Zoom it gets a bit sticky.
So my presentation is a dual. I'm going to present a bit of the historical background of the relationship between Malawian people and the Scottish people. Again, a bit of an overview on previous projects supported by the Scottish government. And my colleague Benjamin is going to talk about the current strategic partnership grant and its achievements. We all know this gentleman here, Dr. David Livingstone, who arrived in Malawi in 1859. And in 1875, he established the first permanent mission at Livingstonia. Because of the initial visit by the great man, Dr. David Livingstone. And we also know that he made an appeal to the Senate House of Cambridge University on the 4th of December, 1857, and I quote, "I go back to Africa to try to make an open path for commerce and Christianity. Do you carry out the work which I have begun? I leave it up to you." End of quote. And the rest is history, because after that, that's why part of the reason we are here. But also you all know that indeed the first president of Malawi, Dr. Subanda, whose name our university bears, was baptized in 1910. Macpherson. My father worked with the Scottish General Macpherson, who he admired, and therefore decided to name his son after him. Dr. Banda got his second degree from the University of Edinburgh in 1941. And Dr. Banda his studies were funded by the government of Nyasaland, but the funding came from the Church of Scotland. Since then, there have been other people that have been crucial in the establishment of the first ever medical school in Malawi that trained in Scotland. John Chipangu trained in Aberdeen. John Wanda is another Malawian who is still currently in Malawi at the moment. In the early 1980s, Dr. Banda decided Malawi shall have a medical school after many years of not having a medical school at all. And he turned to none other than the Scottish people to support him. And therefore, with the Scottish support, he had made contacts with the University of St. Andrews to send the first ever medical students to start their training at St. Andrews for 3 years before going. Students that trained in St. Andrews. That young man went on to become the first vice chancellor of Kamuzu University of Health Sciences, and that is yours truly. So you see, this partnership of the Kamuzu University of Health Sciences, which started as College of Medicine, started way back before actually the College of Medicine started itself. A bit of history, statistics about Malawi. As of 2023, we just over 20 million. With a growth rate of 2.5 million and a GDP of 53.35 billion. We are a country that is still burdened with the loss of infectious diseases, HIV, but also a lot of non-communicable diseases. We're a fairly young population with more than half under the age of 18. And for those that I'm sure, do I need to point out where Malawi is? Maybe for the sake of our colleagues, from University of Dundee. Malawi is a small country in this part of Africa. It's surrounded by Tanzania in the north, Mozambique, and then Zambia on the west. A small country, but with densely populated. Now back to the Kamuzu University of Health Sciences. It was established under the Act of Parliament number 20 of 2019 on the 4th of May, 2021, as a merger of two former colleges of the University of Malawi. Kamuzu College of Nursing, which was established in 1979, and College of Medicine, established in 1991. So it came together. So we're only just over 3 years old. But as colleges, we started as colleges under University of Malawi. We have a vision to become a world-class university and center of excellence in health education, research, and innovation. And our mission is to advance knowledge, professional competencies, skills, and innovations in health sciences through high-quality, student-centered, and innovative education and research that responds and influences to the national and global policies, health and development needs in an efficient blueprint, which aims to transform Malawi to a middle upper income country by 2063, to make Malawi exclusively wealthy and self-reliant nation by 2063. And everything we do is geared towards that. And it has got 7 enablers. Mindset change, that's what you do. Effective governance systems and institutions. Enhanced public sector performance, private sector dynamism, human capital development, economic infrastructure, environmental sustainability. What we do and what we seek support from the Scottish Government answers to these, the developmental blueprint, but also our strategic plan. And cementing the partnership that started 20 years ago. So that partnership, the cementing, started 20 years ago, and some of the work that I'm going to talk about here has been over the last 20 years. For a period of 3 years, between 2009 and 2012, we received funding amounting to £250,000, just over £250,000, to work with the University of Edinburgh in curriculum review of the clinical teaching simulations, Moodle platform, but also University of West Scotland, establishment of the Clinical Skills Laboratory, which was the first time of its kind in Malawi, but also working with the University of Dundee, we formed what we called the College of Medicine Education and Teaching Office, which provided regular pedagogy training. We've worked with the University of St. Andrews in curriculum review, resulting in integrated spiral curriculum, creation of exam banks, modern teaching to establish computer labs and computer servers, capacity building of our ICT staff, but also curriculum management systems. We've worked with University of Glasgow in our Malawi, Zambia, Blantyre-to-Blantyre, and in Lusaka Research Lab, establishment of the Malawi Dental School Project, MALDENT, a governance project of a new university of 20 microscopes, which are being used by both undergraduates and postgraduates. Affiliation with the Arua Guild Cluster of Research Excellence, and recently cholera vaccine work. All this work, we've done it with the University of Glasgow. Just a little bit more about the MALDENT School, the project. In Malawi, we had no dental school until the government came along to support us, the Scottish government. Just like Malawi came to Scotland when it was setting up the first ever medical school, we came back to Scotland when we were setting up the first ever dental school. And with the general support of £1.6 million, we set up the dental school project. This was between 2018 and 2020. So it involved establishment of the dental program, development of the national oral health policy, the first ever. Before that, we didn't have any oral health policy, and establishment of dental disease prevention program, again for the first time. The BDS, Bachelor of Dental Surgery curriculum, was developed and approved in March 2019 or 2019, and recruited the first ever students in August 2019. There are now 118 students under this program. And for the first time, Malawi will have its own homegrown dentists next month. That's when they're graduating on the 30th of April. We also recruited assistant lecturers to support in the teaching of the students. I make no apologies for keeping on harping up about Blantyre laboratory project, because this has transformed the way we service, postgraduate training, but also a bit of income generation for self-sustenance. We got this with funding to the tune of £1 million from the Scottish government. And $200,000 was gotten from World Bank in terms of for equipment, buying of equipment. And the College of Medicine then provided space for lab and office, but also staff that were working there. So it's a pride of KUHeS, a pride of Malawi, this facility. But again, as an icing on the cake, it has its own energy generation, renewable energy, solar energy that powers the whole building. And this is a model we want to follow for all the rest of the campus, green energy provision. And the rest of because we've got 4 campuses, we want this to happen in each and every campus that we have. When we were setting up, we knew that we were going to become a university. Again, we went back to the Scottish government and said, please support us. We want to make sure that when we start, we have the strategic plan, we've got legal instruments, policies, statutes to make sure that indeed we take off with a bang as a new university. And indeed, you came to our rescue, gave us £20,000 that helped us come up with the initial legal instruments. And then COVID hit. But then you again said, we divert some of the You also helped KUHeS with the Scotland Malawi Mental Health Education Partnership, a project with the University of Edinburgh, which has spanned between 2010 and 2020, and has provided short-term courses for clinical nursing personnel. Over 500 have been trained. And also you supported us train our own psychiatrists. Again, for the first time, 4 of them have been trained. And the establishment of a local Malawian AMED program, a specialist program for psychiatric training. And at the moment, we're talking about more than 15 in training. In the process, of course, other institutions, because having seen that this is something that is fantastic and worth supporting, we've had other agencies coming to support. Indeed, the Scottish government has supported us with the Scotland Malawi Anesthesia Project in Malawi district hospitals, Meningitis Research Foundation with Malawi Liverpool Welcome, the Liverpool School of Tropical Medicine and the Ministry of Health. There's the Edinburgh Malawi Cancer Partnership with the Queen Elizabeth Central Hospital and Scottish Emergency Medicine Malawi Project with the Queen Elizabeth Central Hospital, but also the David Livingstone Scholarship for nursing training. So these are some of the examples of the great partnership that KUHeS has enjoyed over the past few years and continue to enjoy. We are where we are, certainly because of the great support that we received from the Scottish government. Allow me at this juncture to pass on to Dr. Benjamin Kumwenda, who is the lead person for the steering committee for Scottish funded projects, to talk about this again, Scottish Strategic Partnership grant that we are enjoying from now. So over to you, Dr. Benjamin.
Yeah, thank you very much. Now I proceed to talk about the strategic. Excellence, research capabilities, ultimately so that it can lead to better outcomes in Malawi. And it has a ripple effect to Zambia, where we also supported them with the development of the lab. It's a £500,000 per year for 5 years, starting in 2024, 1st April to 31st March 2025. This grant really is supporting the previous work of the dental school, which have just been presented, but also establishing governance structures and systems, but also to support the Blantyre-to-Blantyre lab, which is there for diagnostics and also supporting research. that it's generating. So I'll give a little bit of overview for the first year, which was £500,000 distributed through the various work packages that I've highlighted. As you mentioned at the beginning, that we have the freedom to share the money among the work packages depending on the need that was there at that point. So this is how the funds are distributed. This grant is being received through Invest of Glasgow, which also has its portion for supporting its administration. So the governance work package is one of the packages that's being supported with the aim of improving the effectiveness of governance and management of the university. We are hoping and looking forward that by the end of the project, we'll have a strengthened governance structures of the university, but also improved financial management and also effective policy implementation. Those are some of the activities that we are doing under the governance, development and implementation of governance policies and procedures, training on financial management, strengthening leadership and strategic planning, enhancing legal regulatory framework to support university operations, but also doing some policy awareness among the staff. The dental school, this was started with a previous grant of £1.6 million, but now it's being taken over by this governance, this strategic partnership grant, with the aim of improving access to quality dental health services in Malawi. And we are hopeful and looking forward that at the end of this grant, we'll have increased availability of skilled dental professionals and improved oral health services in Malawi. As it has been presented before, now we have 10 dental students who are graduating this coming 30th April, and that it adds on to the number of dental specialists in Malawi. Some of the key activities is training and capacity building for dental students, strengthening the teaching working force through faculty recruitment, infrastructure development. I should mention that the Malawi Dental work package supported the development of designs for the dental school, and because of that, the World Bank was able to give us funds so that we can build this dental school. And the Madden project adopt the technologies and the designs that are able to manage modern dental schools and training. The Blantyre-to-Blantyre work package is also the grant that was in the previously supported by the Scottish government, but continues to be supported in the strategic grant with the aim of establishing a world-class international accredited research and diagnostic facility. Through this Blantyre-to-Blantyre, now there's enhanced research capacity and internationally accredited laboratory services and improved health diagnostics. What we do is to support researchers that probably could be diagnostics. So this has really improved in terms of provision of world-class international services to the society, but also to researchers. Those are some of the activities that we are taking under the Blantyre-to-Blantyre in order to deliver on this work package. We have the monitoring and evaluation. This aim really is to strengthen the investor institutional capacity to monitor, evaluate, and report on its programs effectively. We want to be able to easily generate the data, but also to learn from the data and be able to improve in our functions. The outcome of this is really to have a functional and sustainable monitoring and evaluation system that enhances accountability, transparency, evidence-based decision-making at the university. These are some of the activities: to establish a dedicated M&E office, which has already is underway at the moment, but also to develop an implementation of an M&E framework for the university, to train university staff in monitoring and evaluation, monitoring and evaluation. These are some of the key achievements that we have registered so far. As in the previous presentation, over 118 people or students have been registered in the dental program, and 10 of these are going to graduate, adding to the number of dentists in Malawi. And the development of the oral health policy, which the ministry didn't have, is a huge improvement, addition to the dental care in Malawi. But also, as I highlighted, because of this support, we've been able to get support from the World Bank to construct our dental school. Under governance, the university was established on 4th May 2021. University of Malawi, but they had to be reviewed to meet the current standards. In the Blantyre-to-Blantyre, we've been running diagnostics to the community, supporting research. We no longer need to send samples outside the country. They can all be analyzed within the institution. We have established the M&E unit, recruited staff, and also set up the offices, but also developed the framework that we are going to start implementing in the coming few weeks. So the supporting the university strategic plan, this one of the biggest thing. On the overall, this strategic partnership grant is helping the university deliver its strategic plan. Through the development of the curriculums and the governance, we can see that there's improvement in teaching and learning, but also a improvement in the governance of the university through the policies. The financial systems have been reviewed. All that is contributing to the for staff, they are able to access resources within the institution. On the overall, we are responding to the Malawi 2063, which is a blueprint for the country to bring mindset change. As we implement the strategic plan, we are bringing in the mindset of being able to produce results and be able to monitor results so that people can be a result or goal-oriented in delivering their mandates and objectives. And as we improve the governance of the university through the policies and the curriculum that have been developed, we contribute to the governance system improvement in the country, but also the enhanced public sector performance. We found ourselves in a situation where you wouldn't go outside the country to access services, but there was need for local expertise, local equipment, which Blantyre brings, a local capacity, which these students that have been trained are now available within the country to support the population. These are economic infrastructure brought about by the equipment, by the dental school, all that responds to the Malawi 2063. So this is huge support, not just to the university, but also to the country as a whole and to the Malawian people. The continued support will help us to continue our collaboration, but also further strengthen our service to the community and the research. The continued support from the Scottish processes. This is an ongoing process so that we reach a maximum efficiency and effectiveness as well as accountability within the university. The continued support will help us to grow to a time when we are able to deliver and monitor and measure the performance indicators of the university and of executive offices. But also we are required by government to report on various performance matrices so that we are showing that we are indeed contributing the country accordingly. This will only be possible with the support that we are receiving. But also it will help us assess on how we are moving towards our vision of being a world-class university. Level. And in time, we know that this is going to have an overall effect on various areas on which the country wants to build, in areas of governance, in areas of efficiency, as far as service delivery is concerned, and also in different various aspects, human capital development, all those areas, this grant is going to help us. And we are very grateful for this. Thank you.
Thank you so much. I think that was
Can I just want
really inspiring. You got a couple of words?
just to, I think, both the Scotland Malawi partnership,
Okay.
they've been absolutely key and very supportive. So Stuart and Chad, thank you so much for your support. It's absolutely invaluable. Thank you so much indeed.
Thank you. Thank you.
No, that's great. I'm going to let people ask questions, but I do just want to double check whether Justice Patemba would like to say anything. Also have introduced from Dundee University, Dr. Georgina Cairns. You're there. So it's good to have you here as well. And I didn't realise there were 5 universities in Scotland that were working with you on an ongoing basis and have got all that different expertise and sharing best practice. It's not a one-way street. I'm sure you've come up with ideas that our universities have now picked up. So I don't know, would anybody like to ask any questions, make a contribution? Or is everybody stunned because it looks so good? Yeah, do you want to come in first and say your name so that people online can hear you as well?
Moira Dunlop from the Mamie Martin Fund, and we support the education of girls in North Malawi at secondary school. Thank you so much for that fascinating presentation. Can I just ask Dr. Kumwenda, it's such good news, 10 dentists, because I remember when Maldent was being set up, this is so exciting. Yeah. Can you tell me the gender balance of those 10 students? Sorry, I'm putting that.
Their picture, where's the picture? The picture of the group.
You know, because we all know the extra difficulties faced by women and girls in education at all levels, and it would be tremendously exciting if there was, you know, a gender balance or something approaching it. That would be very, but I understand that's, you know, I can understand some of the difficulties that there would be achieving that.
Maybe we should add, because that information is.
Yeah.
Yep, come in.
Next.
Just to say, all our programs at the beginning is 50-50,
Ah,
all of them,
great.
except the nursing program where is this pre.
That's great to hear. Thank you.
Yeah, we're very much in favour of that concept. Delivering in Scotland's also
Yes.
not perfect ever. Our parliament is still 46% women, so that's the best we've ever been. So there is that issue about giving young women opportunities. It's a really good question. Next, Patrick.
Thank you, Sarah. Thank you
And again, do you want to introduce yourself?
for the presentation. So Patrick Brady, I'm the Policy and Communications Manager at Scotland's International Development Alliance, but in a different capacity. A couple of years ago, I had the immense privilege and pleasure of visiting the Blantyre-to-Blantyre lab, and it genuinely is a world-class facility and a huge achievement. And the fact that, as you say, it's providing services in today, but I wanted to ask a little bit more about the Maldent programme as well, and about to graduate 10 homegrown Malawian dentists. And I think Benjamin mentioned a little bit about further study opportunities and so on. And I suppose my question was the risk of, or what steps are being taken to retain that talent and skill and education in Malawi for the service of Malawians, or at the very least of the region, and the people who come through that project don't go and end up working as dentists here in the United Kingdom, for example, because that has been a challenge in the past. You know, like they would say there were more Malawian doctors in Manchester than there were in Malawi. So what can we do to try to avoid that with the dental graduates?
Yeah.
Okay.
Yeah.
Okay, thank you. Thank you for that's wonderful question indeed. One of the drivers to make sure that we retain is purely by training them in Malawi, you increase the chances of them remaining in Malawi. But another initiative we're making, the reason why Jeremy Bach is in Malawi now is to improve their post-qualification life. Because at the moment, what we're trying to do is to strengthen the district hospitals so that they are conducive to the working environment for the dentists. We want to make sure that indeed, once they leave the dental school, players in this to act as a niche for them to go and work a nice environment. And but also one of the reasons we want to continue strengthening this partnership so that we can take some of them, give them opportunities to be part of the faculty, to train others. So we've actually welcomed the idea that came up with Jeremy to say we need to make sure that we think beyond the dental school. We need to make sure that we prepare them where they're going to work, so that indeed is job satisfaction for them and many groups to come. So we have thought about that, and that's why indeed, yeah.
Just to add on that, I think the oral health policy is something that provides the dental school is being constructed, because sometimes people leave the country because there are no facilities where they can interact with the expertise and all that. So that environment that is being created also helps to make people say, I can grow professionally right here in Malawi. And having the French faculty come from here, Scotland to Malawi is also very good, because as you're progressing, you want to interact with the experts who have made footprints at international level. So these are coming to support us locally in Malawi, which then satisfies all the requirements that makes people in the country. And the Blantyre-to-Blantyre also helping our expertise in the country, because they can do everything right there. Yeah.
I think it's quite inspiring, because I think you mentioned earlier, was it 500 clinical and nursing staff that were trained up? That's huge, isn't it? Presumably that was quite a big impact on access to facilities and health that people need in the community as well.
Absolutely. And that's true indeed, because we're not just concentrating on training on long courses, just long MA training, but also short courses that are so key, because mental health is big in Malawi at the moment. By making sure that indeed you train all healthcare professionals of different levels of seniority, allows them to go out and then help out in various communities within Malawi.
Very impressive, the amount of progress that's been made. I'd just like to ask the question, do you view the dental school, Malvern, and Blantyre laboratory as separate activities, or do you see them as a base upon which you can use them as a hub to develop future programs?
The two now, because both are being supported under one grant, the strategic partnership. So it's more or less like functioning as one thing and drawing expertise from each other as the projects are being developed, as much as they cater for different aspects of health, but they are very complementary in nature. He is also providing service to the dental services, so that we have a way of reaching out to the community in a way that is a cost recovery. So he's supporting both the dental and the Blantyre laboratory. So in some aspects, there is some synergy that has been created through the strategic grant, which is an umbrella grant. Yeah.
So greater than some of its parts.
Yeah.
In addition to you, Chair, with the having new graduates, there's good huge appetite for research, and that will provide an opportunity for them to undertake a lot of research using the Blantyre-to-Blantyre lab, but also some of the service provision, tests, and so on and so forth for service. They're the ones that are going to benefit best, because they just across, and you can see how they can easily use that facility for service provision, for research, and so on and so forth. Yeah. So they are very complementary indeed.
Thank you.
Okay. Everyone has been very polite tonight. I think that's because people are just processing just what an
Yeah.
achievement you've had with that resource and then spreading it across communities in Malawi. You don't want to come in at all from Dundee?
No, it's lovely to hear. It's great to be here, and it's lovely to hear what amazing progress has been made.
Yeah, 'cause I think
And
health
quite
is
rapid,
health is something we take for granted, I think, in Scotland. It's a big political issue in the chamber where we do argue with each other, but we have a very big system, so that support to get things going.
I think, thank you. It's openness in how we set up the projects. And I think one of the great things about the Scotland and Malawi partnership is mutual respect, we just talked about before. Being able to listen to each other. Scottish people being able to listen to Malawians, what our needs are. Is one of those few partnerships where they don't come and say, you want this. We think you want this. We get asked, what do you want? And listening to us, and we're able to explain what our needs are. And starting from the beginning, planning together, how can we deliver this? Yeah. And deliver something, my teacher used to tell me, do simple things first, but do them well. And before you can go to something complicated. And what you see is essentially an example of how we can actually together sit down and say, how do we do our things? How do we make sure that indeed, whatever we do, sustainability is another thing. Is something that has got a bigger impact, that answers to some of the developmental blueprint that Malawi has, and therefore it's easy to get a buy-in from not just KUHeS, but the government as a whole, policymakers as a whole, and yeah, so absolutely, thank you. Yeah.
Right, just before I move on to the next answer, Maggie Chapman, are you still in the room with us?
I am. I'm just about to nip off. I'm afraid I've got to go to another meeting.
So I'm delighted you got back to me to let me know that, because there are two of us in the room for the cross-party group in international development. So it would let us go through the sod's law, isn't it? IT. Right, can we hear you, Maggie? We can see you moving slightly.
Great. Yes. Thanks, Sarah. Happy to approve.
That's much appreciated, and I will second that. And we will now let you go to your next meeting. You'll miss out on the gin, but you have to multitask as an MSP. Thank you very much, Maggie.
Sorry to leave, folks, and thank you for the contributions. Really interesting discussion.
Thank you. Now, can we come both to you?
Yes. Since you raised the issue of University of Dundee, I just wanted to say that there is a Blantyre declaration that was initiated through the University of Dundee, and that has allowed the 6 public universities in Malawi to co-create a program together with the University of Dundee, and 6 students are in training right now, and one of them is from KUHeS, but the others are from the other to ensure that they have impacts in other institutions as well. And so you reminded me because you mentioned the University of Dundee, that there is that other program. I don't know if you remember the member of staff of yours that is being trained at the University of Dundee.
Yes, Chiotha. Yes, he was there yesterday. We met him yesterday.
Fantastic. So that networking is very much alive and ongoing, and that's why it's great to have you guys here in the room tonight as well.
Yeah.
You can hear what those links are about.
And he's taught the students present here.
Okay.
You've had a lecture from him.
Yes. Yeah. Thank you.
Okay. Anyone else got a question? Yeah, we'd like to come in.
Thank you very much, Chairperson. I just wanted to add a few, one point from and management is able to point out if things are not going on okay. So governance is there. Yeah, just make sure that everything is in place. Thank you.
That's very important. Sorry, I forgot that. Thanks for bringing that indeed, because for us, to make sure that indeed what we are entrusted with, we do it as effectively and with accountability, so that indeed we win the trust of the Scottish people, because this is Scottish taxpayers' money. So we have to be mindful that indeed we have to make sure that what we said we deliver, we've delivered in an effective manner, and there's accountability in whatever we do. So that's why we have set up the steering committee chaired by Dr. Kumwenda, and reports to management quarterly to make sure that indeed we are on track.
Yeah. Okay.
Looking at cervical cancer screening in Malawi, and I'm actually going out to Malawi, if all is well, in 2 weeks to work with colleagues at KUHeS and Chad around trying to develop research capacity for masters and PhD students. So thank you for coming, and I hope I might be able to discuss with some of you or meet you in Malawi. Thank you.
Thank you very much.
Yeah, that sounds good. So there's ongoing work and there's things happening, development. You can sense that around the room. Would you like to come in? Did you say?
Yeah, I think for me, as government, just to appreciate the role that's been done by the Scotland-Malawi partnership and also the cross-party groups. Your advocacy in raising funds to Malawi, you can actually see the impact and that is having on Malawi, the fruits that is being that is the project is bearing in the lives of many of the Malawians. So from the Malawi government, we are so grateful to you, Chair, and your West Party group for all that you're doing. And we also extend our invitation to the students from Dundee to visit Malawi and just have first-hand information on what is happening in Malawi. So we are very grateful and we appreciate. Keep on advocating, because what is happening, it's bearing fruits on the ground. So partners that brings most of the things that are being initiated in Malawi, the College of Medicine, the first 10 dentists, the 4 first psychiatrists, it's all coming from Scottish government. So Malawi government is very, very grateful for the support that you provide us. Thank you.
Well, that feels like a very positive note to end on, doesn't it? Because Scottish Malawi Partnership has been here a long time. We actually had a presentation in Parliament a couple of years ago where there was this list of all the Scotland Malawi partnership relationships in every region of Scotland. And I was blown away by how many there were. So it goes back to your very first slide of that relationship, that historic relationship with Scotland. It's a current relationship as well. And I think the students in the room, fantastic tonight. I'm going to stop us now because we could probably talk all night, and I want to give our senior academics and those who run the university a little bit of headspace, and I'm going to allow everyone to network while we're still allowed to be in the Parliament before we get removed, and to make sure that there's no waste. There's lots of water there, but there is also Malawi gin, so you can have alcohol or non-alcohol. But I want to thank all of you for coming tonight. I think it's been a fantastic presentation, and let us say long let this relationship continue and develop with our universities and your academics in Malawi at the university and the government. It's fantastic. So thank you all. My last point of the entire meeting is to say that our next meeting is going to be in September, and that's going to be our annual general meeting on the 17th of September. That notification will go out to everybody who's a member of the cross-party group, and we'd love to see everyone here again. So feel free to keep in touch with us, those of you who've come for the first time tonight. Thank you.